Percuss from BSN1 po, and today I'm going to perform the abdominal assessment. First is we have to perform hand washing. Next is we have to gather all the materials that we're going to use during the assessment, such as the pillow, the stethoscope, the centimeter ruler, and the marker. So, a pleasant day to you, sir. My name is Darlene Percuss, and I'm the assigner who's going to assess the abdominal assessment po. So, I'm going to ask you some questions po. So, have you had any change in appetite?
No.
Any change in your weight?
No.
Have difficulties in swallowing?
No.
Are there any foods that you cannot eat due to allergies?
Yes. Probably seafoods, especially crabs.
Okay po. Have you had any recent abdominal pain?
No.
Any nausea or vomiting?
No.
How often do you have bowel movements?
Every day, probably once a day.
Can you explain the color and consistency?
Brown, solid, regular.
Have any experienced diarrhea or constipation?
No.
Have you any had a gastrointestinal infection such as gallbladder disease,
No.
hepatitis,
No.
jaundice,
No.
appendicitis?
No.
Do you have any operation in the abdomen?
No.
Have you had any history of x-rays?
No.
What medications are you currently taking?
None.
How much you would drink alcohol?
I don't drink alcohol.
Okay. Do you smoke?
No.
Now I'm going to ask you about your diet, sir. Would you tell me about your diet starting from your breakfast until your dinner po?
For breakfast, I had egg, rice, milk, banana, and a glass of water. And for lunch, I had rice, chicken curry, an apple, and a glass of water. And for dinner, I had rice, fried fish, and a banana, and a glass of water.
Would you consider those normal or abnormal?
Normal.
Why?
Because it's a healthy diet.
Okay po. So if that's the case, sir, we will now proceed to the procedures po or assessment in the abdomen. And now for the preparation, position the client into supine, and we're going to ask the patient to lay down. Sir, would you please try to lay down po? So there are two types of position. So the client may lie supine with hands resting on the center of the chest, or with arms resting comfortably at the sides. These positions best promote relaxation of the abdominal muscles. Next is we have to fold the gown, exposing only the abdominal area, but we are not going to do that according to the guidelines. Next we are going to inspect for the skin. So the skin must be pale because it is seldom or exposed to the natural elements. And the next is, if it's purplish, it means that it has bleeding on the abdominal wall, and if it's redness, it means that there are inflammation, and if it's yellow, it means that the patient has a jaundice. And next is for vascularity. Pag fine lines, it means that it is normal, and then if it's deleted veins, it means that it is not normal. And then that's for the vascularity. And next is inspect for the striae or for the stretch marks. Again, if it's dilated, it means that it is not normal. And then next is we're going to inspect for the scars and lesions. And next is we're going to inspect for the symmetry and contour of the abdomen. Next, we're going to inspect for the umbilicus, noting the color. So the color must be similar to the which is surrounding the abdominal area. And then next is we're going to know the location of the umbilicus. So the location of it is midline and at the lateral line. And for the contour, it is protruding and 0.5 centimeter conical and round. So the abdomen should be flat, and then that it should not be scaphoid or distended. And next is that the abdomen should not bulge when the patient raises its head, and it is symmetric. And then next is we are going to inspect for the abdominal movement. First is we are going to see the respiratory movements. And next is for the aortic pulsations. And next is for the peristaltic wave. So it is normal. Next, we're going to auscultate for the vowel sounds, noting the intensity, frequency, and pitch using the stethoscope. So I'm going to warm the diaphragm of the stethoscope. So we actually have 4 quadrants, the right upper quadrant, the right lower quadrant, the left upper quadrant, the left lower quadrant. So I'm going to auscultate starting from the left lower quadrant. So usually at each quadrant, we are going to auscultate it for 15 seconds. So it is normal because there are no hyperactive and hypoactive. Next, I'm going to auscultate for the vascular sound and friction drops using the bell of the stethoscope. So they are all normal, for there are no good sounds. Next, I'm going to percuss for the abdominal tone. And all of the 4 quadrants have tympanic sound, so we can only hear the dullness sound in the liver and the spleen. Next, I'm going to percuss for the liver. First is we are going to look for the intercostal space, so it is in the lungs. We can hear the resonance in tympani. If we hear the dullness, it means that we are now in the liver. So this is now and that would be the liver. Now I'm going to get the marker to mark it down. Now I'm going to start at the bottom to percuss. Now I can hear the tympani and resonance. If I hear the dullness, it means I'm going to stop now and then mark it down. Now I'm going to measure it. So 5 to 6 meters, it means that the patient is normal. Usually the female liver is smaller than the man. Now I'm going to percuss for the spleen. Now I'm going to perform blunt percussion for the liver and kidneys. I'm going to ask the patient to sit down. Sir, would you please try to sit down po? Now I'm going to perform light palpation and deep palpation in all of the 4 quadrants, noting the tenderness and masses. So this is the light palpation. So there is no tenderness or masses. Now for the deep palpation. I'm going to palpate for umbilicus in a circular motion. All 4 quadrants, of course. I'm going to palpate for the aorta. So, now I'm going to palpate for the liver, noting the consistency and tenderness. Sir, wait lang po. Inhale po, sir. Now I'm going to palpate for the spleen. Sir, wait lang po. Sir, inhale po. I'm going to ask the patient to turn his body to the right side. Sir, would you please turn to the right po? Now I'm going to palpate for the spleen. Now I'm going to palpate for the kidney. So usually the kidney are not palpable. So his kidney is not palpable. I'm going to palpate for the urinary bladder. Now I'm going to palpate and test for the shifting dullness. Now I'm going to test for the fluid wave test. I'm going to ask the client to, sir, would you please try to place your hand po in the middle po. So if I experience wavelengths in my in this hand, it means that the patient is positive from the fluid wave test, but since there is no transmission or I did not experience some clap, it means that the patient is negative from the fluid wave test. I'm going to perform for the test for appendicitis. First is we are going to test for the rebound tenderness. So if the patient stated or feel pain, it means that the patient is positive from rebound tenderness. So I'm going to lift this now. So, sir, did you feel any pain po?
No.
So it means that the patient is negative for rebound tenderness. Now I'm going to test for the Robson sign. So I'm going to dip my hand to the left lower quadrant. So if the patient feel pain, it means that the patient is positive from Robson sign. So sir, did you feel any pain po?
No.
So it means that the patient is negative from the Robson sign. And now for the South sign, I'm going to ask the patient to lift his right knee. Sir, would you please try to lift your right knee po? So did you feel any pain po?
No.
So the patient is negative for the South sign. And now for the obturator sign. Did you feel any pain, sir?
No.
So it means that the patient is negative for the obturator sign. And for the hypersensitivity test, did you feel any pain, sir?
No.
So the patient is negative from the hypersensitivity test. Now I'm going to perform the test for the cholecystitis or the Murphy sign. Now I'm going to ask the patient to take a deep breath. Could you try to take a deep breath po, sir? Did you feel any pain po?
No.
So it means the patient is negative for the Murphy sign. And for the analysis of data, formulate the nursing diagnosis and make necessary referrals. And that would be the end of the abdominal assessment. Thank you.